Right now by Scott Ballin. He is a health policy consultant out of D.C. and talking about the FDA and what does the FDA look at? First of all, Scott, thanks for being here. Say hi to Nikki.
Pleasure. Hi.
Hi, Scott.
Scott, does the FDA look at smokeless tobacco the same way as it does tobacco?
Well, in some ways they do, in some ways they don't. I mean, one of the things that people have to understand is that the harm comes when you burn something and suck it into your lungs. There's been general agreement in the public health community for over a decade that non-combustible products, such as smokeless tobacco, and there are various forms of that, and you've mentioned some of the more disgusting ones, but those products are pretty much 90 to 95% lower in risk than cigarettes. And we have to realize that smoking, not use of necessarily non-combustible products, kills 480,000 Americans every year prematurely. It's the single most preventable cause of death in the United States.
Yeah.
And
you remember Tony Gwynn? You remember Tony Gwynn, the Hall of Famer from San Diego? He died from chewing tobacco. It ate a hole into his jaw.
Mouth cancer, right?
Yeah, and that was a different type of tobacco than is on the market today. What has happened is a lot of the science has developed to be able to remove those cancer-causing agents. They're called TSNAs, tobacco-specific nitrosamines. And so the products, the smokeless products, are becoming lower and lower in risk compared to cigarettes. And they're also different forms. There are forms of dissolvables so that, you're not spitting it. It's not that gross wad of tobacco that people stick in their mouth. And there are also something called snus, which is a little packet that stays contained. You get your nicotine that way without all of the toxins, and it's easy to dispose and throw out into the trash. So we've got a completely different environment going on.
But, Scott, you can still get that bad stuff.
You could still, but most people don't like that or are not buying it.
You know what, though? I mean, it's funny because I know a little bit about minor league baseball, and especially in the red states in America, and in high schools and in colleges, and they're still doing it. The colleges, not so much, but you'd be surprised how many high schools, Mississippi, Alabama, Tennessee, Florida, Georgia, Arkansas, still let high school kids chew.
They shouldn't be using any of these products, and I think Major League Baseball has done a good thing in banning or prohibiting the use of these products by ball players, because I don't think most people don't want young adolescents to use any tobacco-related product or nicotine product for that matter.
What about vaping? I mean, is that even being taken into account since it's technically not a combustible, right?
Yeah, yes, that is another. But see, this is what is changing this whole discussion publicly. And people are beginning to understand that all tobacco products and nicotine products are not created equal. The cigarette is the most deadly by far. And as I said before, they cause 480,000 premature deaths every year. And when you start looking at non-combustibles...
But, Scott, we got to stop. Let's stop and reflect on that number just for a second. 400,000 people each year die from a product that is probably more addictive than methamphetamine. And yet you can buy it anywhere in the country, pretty much.
Well, and that's the problem. We do not have a regulatory system in place that regulates products based on risk. As far as I'm concerned, the deadly cigarette should be the one that's regulated the most.
Good luck with this administration getting any forward movement on that.
Although California just raised their cigarette tax by $2 today, so breaking the bank.
Those are also great policies to help move this whole thing forward. But a lot of people, as you may know or have met, when they are addicted to nicotine and they do not have any options on alternatives out there, they end up continuing to smoke. And I think that what has happened with the science and the development of new products such as e-cigarettes that need to be regulated, as well as non-combustible cigarettes non-combustible products like Swedish snus and others, we have opportunities now that we've never had to give these addicted adult smokers alternatives. And as far as I'm concerned, raising the taxes, all of those things are good things to do to try to reduce the devastating toll that's caused.
Scott, they would be good if the money went to smoking cessation programs instead of just, into the pockets of the general fund to disappear somewhere down the hole.
Absolutely. And I was just part of a recent group that issued a new report and recommendations concerning adult smoking and making that thing of the past in the next generation. And that is one of the issues, increasing smoking cessation efforts, raising taxes on cigarettes in particular, and also developing and allowing products that are lower in risk to be available to those people who are addicted. This has not been done in this way before, and I think that this is a real important issue that needs consideration.
I agree. And, Scott, we'll get back to you over the summer here as we talk more about this, and I think you're going to see some momentum. I've heard Major League Baseball trying to push it past the Players Union, and that's the biggest pushback. Scott, is it Ballin? Is that how I say your name, or Ballin?
Yep, you got it right.
Scott Ballin. Thank you, my friend. I really appreciate it.
My pleasure.
Again, a health policy consultant. I like him. Nice guy. Yeah. And you got, it's interesting, that whole edgy thing about it. And cigarettes always pissed me off because, I killed my father and killed, countless other people that, that were I probably known over the years. It's an unbelievable.
And dipping is disgusting.
And they're going to go after pot or, dispensaries.
Right, exactly.
All right. How would you like to go see Dierks Bentley? We're going to play.